Good morning, everyone. It's 9:50 in the morning. Hang on a second. That's a little bit better. Oh, I'm up and at it. I woke up about an hour ago. Went to bed around 2. Woke up twice. Again to go to the bathroom. And then the second time to release some phlegm. But since I've been up for an hour, I've been working more on the diamond painting. I'm at the halfway point. So yeah, once I finish this one, I told myself I'm not doing any others until I get this one done. So this is the one I do at my friend's, but I still got at least 2 more here. And then there's still a bunch more over at the group. So if I can at least finish this one and move on to another one. Yeah. So plus I'm still waiting for my second package to arrive, which has more of the beads, drills, diamonds, whichever you want to call them. I call them drills. To come in, they're refills. So I was running low on a nice handful of the ones that are over there in the bin. So like I literally almost thought there's like less than 10 drills in each. At least a good 6 of them. So, and they're colors that I need for both this one and this one. So, yeah. I have to wait for that to come in. I've been substituting a different color that I had a lot of, which is kind of working out okay, but you can tell there's a difference. So, yeah. Other than that, sorry. I don't know if I posted this yesterday or not, but my good aunt is back in the hospital. She has fluid in her lungs again. Grandma says she's doing okay, which I think Grandma was just like trying not to talk about much. I understand it's hard seeing your child in that state, but you also have to realize the rest of the family wants to know what's going on with that individual. Then they should at least know. And just telling me, oh, she's okay, isn't really telling me much, but still. And yes, my allergies are kicking my butt. I haven't taken any of my medications. Yeah. So, not yesterday, but the day before, I have my health care back, my health coverage, insurance. And they said I've had it since the 1st of July. Now, if that were true, I should have at least had my prescriptions refilled. I should have been able to at least go to my primary doctor. But instead, I was told my insurance is terminated. And then having to deal with, 4 days of an emotional roller coaster. Just trying to get some answer about medical insurance. So yeah. And then yesterday I did call in my prescriptions. They did change some things. Like, two of them. Okay. One is the Cinepro for high blood pressure. I am taking the lowest dose of that. Okay, cool. I still need it because without it, I do get blood pressure headaches. So I'm on the lowest dose. And now I'm being charged, what was it, $5.36 for a 30-day supply. And then for my diabetes, type 2, metformin. To help keep my blood sugar, all that in order. Which without that, I start getting more upset stomachs due to the insulin resistant stuff. Guess how much? $17.19. For a 30-day supply. I know there are other people out there who pay way more than what I would have to pay. So, but I'm on the verge of saying, okay, forget the Lisinopril. I'll just switch over to regular aspirin or over the counter. But the metformin, I do need more. I do need still. Yeah. So I was trying yesterday when I called my primary doctor. When they are busy at the moment, whether it be dealing with patients in the waiting room, coming up to the front desk, or their staff meeting, they don't put you on hold. They don't let you go to their answering service. They pick up the phone and hang it right back up. I called 4 times yesterday, and each time that's what happened. And it sucks because with the Molina, my health insurance, there's a good source of nurse practitioners that you can see as a doctor. And all the ones that I exhausted years before, yeah, I've heard so many bad stories about from other people who are in the same boat as me. And then people who have my doctor, nurse practitioner, they have a lot of good reviews. There's a few bad ones, which is fine, but it's more so like her running late and not letting her patients know. Which, okay, fine, anyways, yeah, I'm still a little tired of this. Still trying to wake up. I should take at least my citrazine. This one is paroxysm. Haha. Citrazine. It's my extra, my stash. I've been tearing into them just to make sure I'm okay. Yeah. So, again, this is what I'm doing today. I'm going to be focusing on diamond painting because, one, the humidity along with the air quality today is going to be worse than yesterday. But the temperature is supposed to be a little bit lower. So anyways, again, I have to quarantine myself. Yesterday, I did manage to make it downstairs a couple of times to check on Grandma, but hubby did most of it yesterday, so. Because he knew, yeah, just me heading towards, going down the stairs towards the door that leads to the first floor. I was already starting to get a stuffy nose just going down the stairs. So he knew if I spent more than a couple of minutes downstairs, I was going to start hacking up a lung. So, and I did, and I had to use my inhaler like 7 times yesterday. 7. So, yeah. Alright guys, that's my little chitty chatty for now. Hopefully you guys are staying safe, cool, and hydrated, and don't forget to have some electrolytes in your system. So, you guys continue staying safe, cool, and hydrated with electrolytes. And I'll see you guys a little later.